Hi, I'm Gina Tabrizi, and I'm the Clinical Director of Harmony Heals Holistic Counseling Center. I want to talk to you about co-occurring disorders. So in our profession, and therapists, psychologists, and in the medical profession, people will hear this term and understand it. But maybe a layperson, you're coming into treatment or you're seeking help, and you start to explain your symptoms or problems to a therapist, and they tell you that you have a co-occurring disorder, and you're like, what the heck is that? A co-occurring disorder is basically that you have two issues and primary issues that are going on simultaneously that both need attention. The two disorders can be a range of things. So in the mental health field, it can be depression and a substance abuse or substance addiction problem. It could be depression and anxiety. It could be anxiety and an eating disorder. So when a clinician is sitting in front of you and talking to you and sees that these two are kind of running your life a little bit, and that these two issues both need to be addressed, and they need to be addressed simultaneously because they're both as powerful in the way that they're operating in your life and what's happening to you. Well, this is called a co-occurring disorder, and it requires our attention in order to help you to start to tease out and to get better and to kind of get on your feet and get a handle and manage these things. It used to be known as dual diagnosis. It's the same thing. It just means you have two diagnoses at the same time. It's really scary sometimes for a client to get a diagnosis. They're like, what does that mean? Am I stuck with it for the rest of my life? Can I get rid of it? Things like that. And so it's important to talk about what diagnosis really is. In the case of dual diagnosis or co-occurring disorders, you're just trying to get a plan together. We're just trying to look at what are the things that are really operating in your world that are not allowing you to function in a way that makes you feel healthy and happy and well-adjusted and have great relationships. And so we need a plan. And in order to get that plan, we're going to take what you tell us, what you're suffering with, what you're struggling with, and we're going to put it into a formula, so to speak. So co-occurring is the formula that says, look, these two things need our attention. There might be 3 other things. There might be 5 other things. There might be nothing else that you really need to take a look at. But these 2 things have to get our attention because they're not allowing you to live your life in a way that you want to live your life. It's a word that's used commonly in our field, so you're going to hear it when you're seeking help and looking into different, websites or reading and whatnot. So when you hear it, understand all they're saying is that you got 2 problems. And you need to take care of these 2 problems because these 2 problems are wreaking havoc in your life, and you're not going to get better until you address them. Harmony Heals works great with co-occurring disorders, and most of our clients honestly come in with 2, 3, or 4 different diagnoses or maybe more. The most important thing, I think, and the beauty of it is that we take it and we whittle it down so we dealing with these 2 things or these 2 issues that we're looking at, and we're going to base it on priority. What's the thing that's affecting you right now in your daily life that you cannot put aside to deal with? So if in your disorders or in your diagnoses you've got some family issues or some marital issues or relational issues, maybe that doesn't take the priority. We put it on the back burner because we got to deal with your addiction because you're drinking every day or using heroin or substances or OxyContin prescription drugs daily, and it's now caused you to have a DUI or you're about to lose your job or whatever. Well, that's got to be one of your disorders in your dual diagnosis. That's got to take priority. And then the other thing is probably depression or anxiety. Depression is really, really common these days. Unfortunately, it's something that a lot of people do suffer with and understand. And it's something that very oftentimes they will not seek help for because they think they're just going to get over it. So it's important to know that depression is real. It's not just being in a bad mood or being sad and you can't get over it. It's something that requires attention and counseling and often medical attention as well. So Harmony Heals works very well with dual diagnosis and co-occurring disorders, and we would love for you or your loved ones, if you know that you're suffering and needing help in those areas, to come in and get an assessment and contact us so that we can start helping you today. If you're looking for individual or couples counseling, we would love for you to contact us at Harmony Heals Holistic Counseling Center.